Dr. Cavan, we're going to wrap this up, but one last thought on the different theories behind what causes type 1 diabetes. You mentioned before that it's not a lifestyle disease. You're not type 1 diabetic because you ate the wrong types of food or because you didn't exercise. So what are the possible causes behind type 1 diabetes?
Well, that's a really difficult question to finish on. It's an easy question. It's a very difficult answer. But in a nutshell, I said it's an autoimmune disease, and that's because the body's immune cells attack the beta cells that produce insulin. So the million-dollar question is, what is it that has triggered that attack? And we don't know the answer, but it is likely to be something. There is something that we are exposed to that triggers that immune attack. Type 1 diabetes, it occurs because the body's immune system attacks the insulin producing cells. And there are lots of theories as to what triggers that attack, possibly a virus infection or exposure to proteins or something in cow's milk or whatever it might be. But not everyone who gets that infection gets type 1 diabetes. So we know that there are some genes that are associated with type 1 diabetes. So it looks as though if you have the right genetic makeup, or rather the wrong genetic makeup, if you've inherited the genes that make it more likely you get type 1 diabetes, and then you are exposed to the trigger, which might be an infection, or it could be infection at a particularly bad time of stress, whatever it is. But that trigger then triggers your immune system to target your beta cells. So it's a combination of genetics and then something in the environment that triggers it, but we don't really know what it is just yet.
Well, I think if we know what gene it is or what the triggers are, then we might address those as a possible cure for type 1 diabetes. Well, but we're a long, long way away from that, I think.
Well, if I tell you that 30 years ago, my MD thesis was on the genetics of type 1 diabetes, and we were looking into those genes. 30 years later, we know a lot more, but we still don't know the answer. You're absolutely right. We need that information, but it seems the more we find out, the more we need to find out.
Well, while we're waiting to find out, we can all adopt healthy lifestyle, whatever that may be for you, and try and keep our blood sugars in a normal range in order to avoid diabetes-related complications, which are numerous. Would that be a good message to end this on?
Absolutely.
What else would you add to that, Dr. Cavan?
I don't think I would. I think I would just say, reiterate what I said earlier. Type 1 diabetes is a condition of carbohydrate intolerance, and that adopting a lower carbohydrate diet can help you achieve more stable glucose levels. If you can achieve more stable glucose levels, it improves your immediate health and well-being, and it protects you from those complications from the future. So I'd encourage everyone with the condition to think what they can do, not just with their insulin doses, but also with their lifestyle to help achieve that level. But I know it's not easy, and I think anyone who pretends it is really doesn't know what they're talking about.